heard plenty about my struggles with keeping up with dry January, but here to give me plenty of reasons to keep it going, we got Dr. John Higgins, professor at University of Texas, but also the cardiologist at UTHealth Houston. Thank you for joining me.
You're welcome, Chelsea, and don't give up.
Don't give up, that's the thing. Keep it going, pick it back up and keep it going.
Right.
Well, so what are some of the benefits of taking just a month off when it comes to drinking?
Well, actually, the dry January idea originated in England in 2013. There was a lady, Emily Robinson. She was training for a half marathon. And she decided as part of her training to take a month off alcohol just to see if it helped her training.
Yeah.
And it really did. She was sleeping better, she had more energy, and she did better on the half marathon than she had done the year before. So she started this whole concept up, and it's grown since then for, giving it a try and see if it'll actually help improve, how you're feeling and what you can do.
So even if we're not trying to run a marathon, we can see benefits in our bodies.
Exactly. A lot of people, Chelsea, talk about the fact that they can sleep better, they can concentrate better, they can just do things better. They're more sort of awake and more focused and in the zone than if they are, constantly hitting the alcohol.
In the bottle, yeah. So I've heard of people who start dry January and then, it's dry February and March, and then they're pretty much alcohol free their whole lives. So what are some of the benefits to actually taking it up as a lifestyle?
Well, we know that excess alcohol can have negative effects on all systems in the body, everything from, the brain, the heart. We know that, it can affect the heart, cause high blood pressure. Your heart can get a bit weaker. Also, it's associated with coronary artery disease in excess. And just recently with the Surgeon General's warning, increasing the risk of certain cancers, including head and neck cancer, breast cancer, colorectal and esophageal cancer, and pancreatic cancer. So there are definitely some long-term benefits of sticking off the alcohol. And, I think nowadays we actually have some pretty good substitutes as well. I mean, in the olden days it was, alcohol, water or juice, But now, we have the whole growth in the mocktails as well as now the zero alcohol beers.
Yes.
And, I've actually tried a number of them myself, and some of them you cannot tell, the taste difference between the regular beer. And yet, you're okay. The good thing is, you're okay to drive, you have a good sleep and you don't have a hangover and whatnot. So I think there's so many different great substitutes these days that you can definitely give it a good try and be pretty successful.
Okay, I'm going to try some of that later in the show. But, we've always heard red wine is so good for you. So is there a change in that advice? Okay,
so of the different alcohols, it appears that the worst alcohols are going to be the hard liquors and like the beers. They're the kind of empty calories and I mean the not good in terms of other benefits. However, we've known for a while since, the description of the French paradox that red wine consumption seems to provide some health benefits in individuals. So we're talking about, 1 glass per day for women and 2 glasses or less per day for men. It appears that it can relax some individuals, actually, lower blood pressure for some individuals, as well as improve their cholesterol and help them sleep. Again, it's only in moderation, and typically it seems to be most associated with red wine, Chelsea, consumption. So that may be something that if you are going to have alcohol occasionally, that it may be reasonable to consume. And I would recommend wine versus the other hard alcohols and beers.
Okay, all right. 1 glass, ladies. Okay,
yes.
Got that. When it comes to social drinking, what are the guidelines or things we should think about? After dry January, of course, when we pick it back up, what are some things to consider?
I think one of the things is that I always tell my patients is, for every alcohol, as I said, in some individuals in moderation can have some benefits. So I always tell them to remember that alcohol can dehydrate you, which is not good. So for every glass of alcohol, I always tell my patients they've got to have, a glass of water to compensate for the dehydration. The other thing that sometimes people will do is, especially if they're social drinking, you know, everyone's in a good mood, you know, someone buys a round, then someone else will buy another round, and you can get into the situation of binge drinking, which is not that great, you know. So essentially having, you know, 3 or more drinks in one session is considered binge drinking, and that's when you start getting into the harmful effects of alcohol. And the other thing that I have to remind people is that, okay, you know, 1 drink per day does not mean, okay, I don't have anything Monday through Friday, and then I can have 6 drinks on Saturday.
Stack them for the weekend. It doesn't work like that.
Yeah, it definitely doesn't work like that.
Okay, all right, good to know. Great advice, Dr. Higgins. Thank you so much for coming in. After this break, I'm going to try some of those non-alcoholic beverages you were mentioning. Okay?
The mocktails. Yeah,
yes.
Good luck, and good luck with the dry January.
Thank you very much. All right, you guys keep it here. We'll be right back.